Let's talk about something we don't discuss enough, our brains. It's funny, Beth Sulkowski from the Alzheimer's Association is here to talk with us about Brain Health Awareness Month, which is June. But brains are not something we discuss often, and yet they are oh so important.
That's right. I mean, if you are a family who has been living with or facing Alzheimer's or dementia, it's something that you think a lot because it's impacting your daily life. You need that support. You need the resources through the Alzheimer's Association. But for the rest of us, we aren't necessarily thinking about our brains. We might be thinking about our beach bodies or
yes, yes.
But this is one more reason to take your health seriously. During June, Alzheimer's and Brain Awareness Month, we're encouraging people to really take charge of your brain health because the science is showing that the brain changes that happen with Alzheimer's they start changing about 20 years before you start seeing symptoms. So there's a huge window for intervention, and a huge study has shown that as many as 40% of dementia cases can be delayed or prevented by modifiable risk factors.
That's incredible, and I'm thinking about it. I've shared this before with our viewers and with you. My grandma passed away from Alzheimer's disease, and we have it still in my family. What are the things that we could be looking for in that 20-year span that might not necessarily be super noticeable to others?
Well, the warning signs are going to happen further down the road. So, it's not just forgetting where you put your keys or forgetting names. I forget names all the time. I'm the worst with names. But changes in social withdrawal or changes in rational thinking, wanting to donate money somewhere that's like, that sounds like a scam. All these different things start changing.
Right.
It's happening on a cellular level in the brain. You've got to, I guess, start fighting it before you see it.
So in that period, so we've got 20 years from the time it starts changing here to the time our outward symptoms start. What are some of the things that we can be doing health-wise to keep our brains as healthy as they possibly can?
So the things we know we need to be doing anyway: being more physically active, protecting your brain, wearing a helmet if you're doing bike riding or motorcycling, but also, eating a healthier diet, less fats, more fruits and vegetables, staying socially and mentally engaged, continuing to learn things and being involved in your community with people. Isolation can be really challenging to overcome, to get the stimulus that you need to keep your brain active. So those are all, pretty easy steps that we can take. And if you go to alz.org, we've got 10 healthy habits for your brain.
Before we let you go, you are signing people up and signing teams up right now for the Walk to End Alzheimer's, which is in October.
That's right, October 19th at Segra Park. And this is a great way to get involved in the cause, whether you've lost someone or it's something you just want to see a future without Alzheimer's. You can sign up at alz.org/walk. It's a great time to start a team and start your fundraising and check off some of those physical activity, social engagement, those things that are great for your brain. You can do that by being a part of the walk.
All right, fabulous. Thank you, Beth, and thank you so much for all the work you are doing for Alzheimer's.